It's a lot, but they all kind of go together because in a biological practice, we do have to be very minimal and invasive, and biomimetic helps us with that.
Right.
And oral systemic periodontium, I mean, that's the whole basis of our oral health. And we take that very seriously, where we don't start any restorative work unless the patient has a healthy periodontium. I mean, we really believe that is the basis and that's the start of every patient. I mean, our we call our hygienist periodontal therapists, and in our practice, we have the most respect for them. I mean, we have more respect for all our team members, but we're talking about the oral systemic, and they're a key part of in this, and they work really hard. We try to educate every patient um, about this, and the biomimetic allows us to be conservative in our treatment, and that's a technique that allows us to be minimally invasive, which can be part of the biological aspect of it. And
Yeah, well, I named three different components. I named the oral systemic, um, integrated, biological, kind of combined, and biomimetic. And in fact, they're not disjointed. They're all connected to one another um, in kind of philosophical approach. So you've got a very consistent practice in kind of honoring what you've learned in oral systemic and integrated, biological, and biomimetic. Um, and yet also there's a general dental component of your practice that's part of your practice as well.
yes, give you one example of our oral systemic. We've had a patient that one of our hygiene team member was trying to get them under control. Then we did a salivary test. We found out that actually the gum inflammation is not coming from biofilm, and we referred them to a physician, and we were able to help the patient diagnose diabetes, and they were very grateful for that. Like, we take blood pressure at every visit. I mean,
Yeah.
we try to explain to patients that this is not just your teeth; it's a whole body health, and preventive cares are fundamental in our practice.
Yeah, yeah. I love that, Bahram. That I always say dentistry rocks, and I truly do believe that because we have the ability to change people's lives every day. Could be something we do clinically, or it could be something we do behaviorally.